Gentleman yields back, and now recognize Mr. Armstrong for his 5 minutes of questions.
I'm going to talk a little bit about data, but I'm going to do it in a little different way. Sunday morning, April 18th, 2021, was the first time I knew we had a problem, and we had a real problem. And there was a hearing, and people got in an interesting conversation, but the head of the CDC was on a Sunday morning show on CNN and said, this is a public health issue. It is not a civil liberties issue. This has nothing to do with civil liberties. This committee's been working on comprehensive privacy legislation, and the focus on the extent to which American sensitive information is in the hands of third parties, particularly data brokers and purchasers of that data. In a recent subcommittee hearing, we learned how seemingly de-identified data can easily re-identify individuals. While our focus has largely been on private actors' use of this data, I have been equally concerned about the government's purchase and use of this data. In March, FTC Chair Khan testified before the IDC subcommittee that, quote, a lot of people have concerns about data collection by the government. I would argue that we should be more concerned about government's collection and use of this data compared to private actors. Republican members of this committee sent a letter to CDC Director Walensky in May of 2022 inquiring about the CDC's $420,000 purchase of Americans' location data to monitor COVID lockdown compliance. Mr. Chair, I'll seek unanimous consent to enter that into the record. The company the CDC bought this data from has a checkered history, if I'm being polite, of misusing location data. They have sold 2 years of deaggregated data, device-specific location data, to the Illinois state government, which, guess what, turns out wasn't de-identified. And they were selling ads in real time to women who were sitting in an abortion clinic. That's who the CDC contracted with. This CDC data request details a list of 21 different potential uses for cases for that data, covering location information, points of interest. The CDC request specifically sought data to track people who were attending places of worship during quarantine. CDC's response to the committee was that it has the authority under 42 USC 241, which is a vague authorization to research diseases. And I want to repeat that. The CDC cited general research statute as justifying purchasing location data about Americans exercising their First Amendment right. The CDC response to the committee's letter also dedicated an entire paragraph describing how this aggregated and anonymous data population. Again, we have hearings in this subcommittee last month describing that's a fallacy. And multiple studies since 2013 show that less than 5 points of data are enough to re-identify 90% of individuals. And individuals can really be identified, particularly when they're going to mass in a place like Beulah, North Dakota, that has under 4,000 citizens. If we're going to legislate on data privacy and we're going to continue to get asked to provide more and more data, I think it's our duty to address government access to what the Supreme Court has referred to as the timestamp data that provides an intimate window into a person's life, revealing familial, political, professional, religious, and sexual associations. I don't know. There's a lot of debate about Dr. Fauci. I'm not a doctor. I never went to medical school. I have no idea. But you know what I know he's not an expert on? Civil liberties. And when people continue to ask us for this stuff and they say that civil liberties have no place in an emergency, my response to them would be that's when they matter the most. I don't care if it's a 15-day emergency order. I don't care if it's a 2-year emergency order. Civil liberties matter the most when the government is trying to clamp down on them. And when we have the head of the CDC on a Sunday morning show acknowledging that he didn't care about civil liberties while he was pontificating out to be the expert on this, because I have a lot of constituents that cared about their civil liberties. I have people who couldn't send their kids to school. Whether that decision was right or not, that's an infringement on their civil liberties. I have people that were worried about whether they were getting tracked to church during quarantine. And so if we want to fix this data conversation and we want to be able to track whatever the new disease is and how we do this, the first thing we have to do is figure out how we protect this and keep people from having their identified by a government that really, really is trying to help, but people don't trust him. And it doesn't help when the head of the CDC, who knows nothing about civil liberties, is opining on them on Sunday morning, April 18th, 2021. And with that, I yield back.